In this video, I want to help you understand some general ideas about when you can return to work after an injury. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I help athletes and active people like you feel and perform your best regardless of age or injuries. Now, going back to work is a huge deal. I've had various injuries and problems for which I was worried I was going to miss a few days of work, and that was like one of my biggest concerns. If it's a surgery, like when am I going to schedule surgery so I don't miss much work? I hear that from my patients all the time, whether it's adults, in the case of high school kids, it's not work, it's going back to school, but everybody wants to try to miss as little work as possible. But sometimes the activities you do at work can actually, hurt the repair, or depends on what the injury or the surgery is. Plus, that injury or surgery might make what you do at work difficult. So let me talk about it generally. As I always say, talk to your doctor, because based on your specific injury, whether it's a fracture or a dislocation, an ankle sprain or whatever it is, or if it's a surgery, there may be different restrictions on what you're allowed to do in the days and weeks after it, so you want to make sure that you know specifically what you're allowed to do so you don't set yourself back. But generally, so much of it depends on what you do. If you do a desk job, and so many of us do, where we're sitting at a desk, responding to email, typing up reports, talking on the phone, and doing all sorts of other communication. This is like the high school kids at school where you're just basically, sitting in class and taking notes and taking tests and that kind of thing. You can do just about anything. Even if it's a shoulder injury or a shoulder surgery, you can get to your desk, and even after a shoulder surgery, most surgeons are going to let you take the sling off and you can write and type it as long as your hands are in front of you and not reaching way up overhead. You can do that kind of thing. Now, after a shoulder injury, you do have to, if you're in a sling that you're supposed to be in all the time, you may not be able to drive to work. That's worth talking to your doctor about. But if you have somebody that can drive you to work, you very likely can get there and do your desk job. Where it gets more, trickier is basically if you have jobs that require the use of your arms. If it's reaching up overhead, if it's lifting things, that's where a lot of times you're going to have some restrictions. So carpenters, mechanics, contractors, construction work people, and really all sorts of people that do physical activity, there you might be restricted for longer, maybe 2 weeks, maybe 4 weeks, depending on the injury or the surgery, but that's where you're going to have the trouble. The same thing goes with lower body injuries, foot, ankle, knee, hip, that kind of thing. The big question there is, how much weight are you allowed to put on it? Are you strictly non-weight bearing, where you're using crutches, you can't put any weight on it? Can you put a little bit of weight on it, or can you sort of walk normally as much as pain tolerates? Again, even if you're non-weight bearing, like we are after some fractures and after some surgeries, a lot of times we'll let you go back to work. If you have crutches, if you have a walker or one of those rolling scooters where you basically put your knee on it and sort of roll yourself along, you can get from point A to point B without putting weight on it. Again, the trick gets to if you have a job that requires sort of manual labor and you doing things, the mechanics, the carpenters, people that work in the yard, landscapers, that kind of thing, where you're having to walk around a lot. Or maybe you work in sales and it's not just picking up the phone and calling people, but it's actually going door to door. It's going to visit suppliers or vendors or consumers. That can be where it's tricky. So again, talk to your doctor about your specific job duties. Maybe you can work from home just for a short period of time, or maybe you can do modified activities at your job and somebody else picks up the more manual parts of your job just for a little while, but those are worth talking to your doctor about. If you have more questions about this or more comments about this, leave those in the comments below. If this video is helpful, click the video below for much more helpful information. Please subscribe to get tons of great helpful information, and I look forward to seeing you right here next time.